All right. For our first question, number one, we're looking at an 18-day-old infant develops bradycardia. So what is our main term? What is our condition that we're going to look up in the alphabetic index for this one? Bradycardia. Yep. That's our condition. And then the neonatal is just going to be the information or the additional details that we need. So once we look at bradycardia, neonatal, what is our code we're going to use? Yep, B, P29.12. Okay, any questions on that one? That one's pretty simple, but any questions on that one? Okay.
Oh, I'm sorry. Can you hear me?
Yeah, I can.
I was wondering if there was any specific guidelines covering that or no.
For this one, no. It's just a matter of just making sure that we are accounting for the fact that we're coding for the infant and not an adult. Yep. Okay. Number two, an x-ray is performed for pain in the left little finger, and this is the initial encounter for the visit. And the x-ray report shows a fractured distal phalanx that is dislocated. So we can start to do some process of elimination. Okay. We have three that have the S62.637. Two of them have the letter A. One of them has the letter B for our seventh character. So let's go take a look at the S62.637, see if that is our correct code. If it's the correct code, then we can determine whether or not the A or the B is the correct seventh character. So again, S62.637. So that 637 is the displaced fracture of the distal phalanx of your left little finger, which is what we've got, right? Left little finger is the anatomic location. Fractured distal phalanx that is dislocated. So the dislocation is going to be included in that fracture because it's kind of like when we have superficial abrasions and bruises at a fracture site, we're going to assume that those came from and resulted from the same fracture. So we're not going to code the dislocation separately. So your S62.637 is going to be the correct one. And then let's look at our seventh character. Do we need letter A or do we need letter B for the fractured distal phalanx of the left little finger? Okay. So Dawn says A, Carrie says B. So does our scenario indicate open or closed fracture? Oh, sorry, Carrie. I thought I saw it come in at the same time. So good. Okay. I'm glad that, okay. So yes, it is, Jennifer, if they do not specify open, then we can assume that it is closed. So it is going to be seventh character A for initial encounter for a closed fracture. And then we know it's going to be the 637. And then, like I said, you can assume that dislocation, or not assume, I'm sorry, we can code only the fracture, and that fracture is going to include the dislocation. So we should not report the dislocation separately. Does that make sense to everybody? Any questions on that? I want to make sure that you guys understand.
Yes, it does make sense. I just am wondering, is there a guideline that can be highlighted in our book that goes over that?
Um, Let me look to see if there's a specific guideline. However, I do know that if you were to follow your alphabetic index and you were to look for the dislocation, then the dislocation tells you to refer to the displaced fracture. So let me
Oh,
look
okay.
real quick and see if there's a guideline on that. I don't believe there is, but let me double check. Um, no, there is not a specific guideline. However, you can write that in there so that way it's just a visual reminder that dislocations with fractures are going to be included in your fracture ICD-10 code. So you wouldn't code those separately.
Okay, thank you.
You're welcome. Absolutely. So for number two, it's going to be again that fracture only, the S62.637A, and then we are not going to code the dislocation separately. Okay, any other questions on that one? Perfect. Number three, we have a patient that is seen for an initial replacement of a leaking dialysis catheter. So what ICD-10-CM code are we going to report? In this one, we don't have two that are the exact same, but we have two that are very close, right? We have T82.41XB and T82.43. So since those are very close, let's go take a look at those. T82.41 and T82.43. So T82.41, that is going to be for a breakdown, a mechanical breakdown of vascular dialysis catheter. And T82.43 is for the leakage of a vascular dialysis catheter. So does anybody think that one of those should be it, or do you think we should keep looking? Okay. So Tansy says the T82.43. Zinnia says the leakage one. So that's the 43. Okay. Does everybody agree that T82.43? Anybody think differently? Yep. And then our A for the initial encounter. Yep. So any questions on that one that you guys can think of?
I have a question, Tiffany.
Yeah.
How do you know if it's when it says initial replacement? I know some Z codes have attention to a catheter. How would you know that this is saying attention to a catheter or is and like how would you do you see what I'm saying? Like it says initial, but then how would you know if it's like an encounter for a attention to a leakage catheter? Like a Z code, the different.
Is that what the Z49.02 says? Hang on, let me look at it here real
No,
quick.
like
I hadn't even looked at that one. So let me look at it so I can see the verbiage of it with my own eyes. Not that I don't believe what you're saying, but my brain does not process it without seeing it sometimes. So
let's see.
Z49.02 is for encounter for fitting and adjustment. So the reason that it's going to be the T code and not the Z code is because it is a leaking dialysis catheter, whereas your
Okay.
Z49.02 is if it is functioning appropriately and they're just fitting it or adjusting it, and there's not a
Oh,
complication of it. Yeah.
oh, okay, got it.
Yep.
Okay. Since it's leaking, so that would be a complication and not an
Exactly.
attention. Okay,
Yep.
got it.
Exactly.
Okay,
Yep.
thank you.
And then you're very welcome. And Jennifer, Dawn, just exactly what Dawn said. The key word in the alphabetic index, if we're looking this up from scratch, would be complication. Because if we think about if a catheter is leaking, then that's a complication of that catheter.
Okay,
Okay,
thank you.
you're very welcome.
Thank you.
And you're very welcome. Absolutely. Any other questions on that one? I know that complications of mechanical things and catheters and things like that can get a little confusing. So good questions, good conversation. Okay. Let's do number 4. Patient has an open, displaced, sunburst fracture of the second cervical vertebrae. This is her 5th visit, and the fracture is healing normally. So let's look at, we have 2 codes that are S12.190. One is 7th character A, one is 7th character D. So let's go take a look at those. It's 12.190. So S12.190 is other displaced fracture of the second cervical vertebrae. Yep. So for this one, it is going to be the S12.190 because the S12.9 is for a fracture of the neck unspecified. So we can see that the other displaced fracture is going to include the sunburst because that's our detail of the other. All of the other options that are in your S12 do not indicate sunburst. So therefore, that's why we can use the other displaced. Okay. And then for the 7th character, we're going to use D for the subsequent encounter for fracture with routine healing. Now, let's say, so our answer is going to be C. Let's say this was her 5th visit, but they are continuing to have treatment towards the fracture. What 7th character would we use at that point? So again, 5th treatment, and they are continuing, or sorry, 5th visit, and they are continuing treatment. What would our 7th character be at that point? Okay. So I've got some D's, I've got some D's or G's and B's. Okay. So, Carrie, why would it be your initial encounter? I just want to hear thought processes. It's still being treated. Correct. So, initial encounter does not mean first visit and only the first visit. That's what our brain is telling us is initial means first, right? However, from an ICD-10 perspective, when we have A's and all of initial encounters, subsequent encounters, and all of those, initial encounter means active treatment. So you can have multiple visits where active treatment is happening and it still be considered initial encounters. Subsequent encounters means that they are in the healing phase. Okay. So there's not any active treatment that's happening during the encounter. And it, like in this scenario, you have D for routine healing, you have G for delayed healing, and K for non-union. So if they are not actively treating it and they notice that it's healing routinely, then it's going to be D. If they are not treating it, but it's delayed in healing, so it's healing a lot slower and it's delayed, then that would be your 7th character G. And then if they are not treating it and there's a non-union, meaning it has healed, but it is not healed where it should be, then that would be your letter K. Okay. So just the kind of recap. Initial encounter does not mean very first visit and only very first visit. It means your active treatment. Subsequent encounters just means that it's your healing phase. Okay. Does that make sense? Anybody confused on that? Do we need some more examples or does that make sense to everybody? Active treatment or initial encounter is active treatment, and then subsequent encounter is healing phase. For the which last example are you talking about, Bailey?
So the one where you said if the patient is still coming
Mm-hmm.
and some of them,
So non-union just means that it has healed. It's no longer in the process of healing, but it's not in union the way that it should if it healed properly.
okay.
So if we think about something that's a non-union, it hasn't come back together appropriately, right? So that's going to be your non-union from that. Okay. Any other questions? Okay. Go ahead and move on to number 5. A patient is admitted to surgery to treat an open fracture to the shaft of the right humerus and a simple closed fracture of the left tibia following a side-by-side ATV accident. Okay. So for this one, we can do the S42.301. We have 2 that have letter B, 1 that has letter A. Let's go to S42.301. And that's the unspecified fracture of the shaft of the humerus of the right arm. So it's the right humerus. And then are we going to use letter A or letter B?
I would say we would use letter A because it's an initial encounter because they are in surgery.
Okay.
They were admitted to surgery.
So yes, A and B are both initial encounters. One of them is going to be for an open fracture, one is going to be for a closed. So if we have an initial encounter for an open fracture for the shaft of the right humerus, is that going to be 7th character A or 7th character B? So Carrie, while everybody's kind of marinating on that one for a second, you say that you don't have B as an option because you need to go all the way to the beginning of your 7th or to the category for S42. So this is a good prime example of making sure that you are not using the 7th characters that are in S42.27 because those 7 characters that are listed there can only be for that subcategory. It's a very common mistake to make, so don't feel bad. I've done it in the past. Students of mine do it all the time. Yep. So it is a open fracture and it's initial encounters because we are doing current treatment. So we're going to use letter B for the open treatment, initial encounter for an open fracture. Okay. So the S42.301B is going to be our code. Then we need to look at S82.202 and then determine, are we going to use 7th character A or B? So S82.202, and that's for the unspecified fracture of the left tibia. So are we going to use 7th character A or 7th character B for our tibia fracture? Yep, we're going to use letter A because this one is a closed fracture. It's a simple closed fracture of the left tibia. So now that we've ruled out that one, and then we know that A is not our answer, then we know that option C is our correct answer for number 5.
Hi, sorry, I had a quick question.
Of course, what's up?
So I'm just asking this as a coding from scratch perspective. I see in our guidelines, it says multiple fracture sequencing, and it says to sequence in accordance to severity. So could you just explain that for me?
Yeah, of course. So your severity of fractures, your open fractures are going to be more complex than a closed fracture. So if we think about if we have somebody that is skateboarding, okay, and they break their arm, but there's not an open fracture where there's a break in the skin, then we can assume that that type of fracture is going to be less complex than someone that has an open fracture where there's a break in the skin. It has probably ripped through muscle, all of the other things. So the highest severity, quote unquote, the more complex is going to be your open, and then the least complex is going to be your closed.
Okay, thank you. So let's say if this started off stating the closed fracture first and then leading into the open fracture, we would code the open first, sequence it
Correct.
first.
Yeah. So if these were reversed in this scenario, yes, and they said that they had surgery to treat a simple closed fracture of the left tibia as well as an open fracture to the shaft of the right humerus, you would still sequence them in the order that letter C has because the open is more complex than the closed. Correct.
Okay, perfect. Thanks.
You're welcome. Absolutely. Good question. Anybody else have any questions or need more clarification on that? All righty. Number 6, we have the patient has a mass on his forehead. He says that it's from a piece of sheet metal from a laceration to his forehead months ago. And he has an x-ray showing a foreign body that is in the mass. After obtaining consent, the metal fragment foreign body is removed from the subcutaneous tissue. So what ICD-10 code or codes are we going to report? Okay. So this one, we have 3 options that have S01.82, right? 2 of them have letter A, 1 of them has a letter S. So let's go look at S01.82. So S01.82 is going to be for a laceration with foreign body of other part of the head. So we know that that's what it is, right? Because we had that laceration to his forehead months ago. So are we going to use 7th character A for initial encounter or or S for subsequent? Okay, got a couple A's. For coming in, okay, so I've got an S in there. Coming in for the appointment, are they doing active treatment at the time of the appointment? Not coming in and then deciding to do something, but is the active treatment for that laceration happening? Or has that laceration healed and it is now considered a sequela because it's a condition that has arisen after the healing phase has been completed? Am I making sense? So, is there active treatment happening at the site of the laceration? And that's why the patient has come in. Correct. So no. So since there's not active treatment happening towards the laceration during a healing phase or during the actual condition itself, so the laceration has healed, right? It happened to the forehead months ago. So the acute illness or injury has resolved itself. We still are retaining the piece of metal in there, but the acute laceration and the healing phase of that laceration is not currently being addressed. Does that make sense? Am I saying it the way that your brain is making it make sense? So, if that's the case and we are no longer in the active treatment phase, the letter A's are incorrect, right? We know that the acute phase of that injury is no longer applicable. So now we are looking at a sequela because the piece of sheet metal is still in there. They have to do an x-ray to show that foreign body. And then that metal fragment is going to be removed. So it's kind of a roundabout way of thinking, but it's not currently being treated. We are going to treat it because we're going to remove it, but the laceration itself is not currently being treated. Okay, does that part make sense? Okay, so if you need a little bit more, what's the word? If you need a little bit more encouragement or confidence, a little bit more support to know that we should not code the acute if you're not 100% sure, then let's go look at this M79.5. Because that's going to tell us whether or not we should use that. So M79.5. And that's going to be for the residual foreign body within the tissue. So this is just another additional support telling us that letter C is our option because that residual foreign body, which is the sheet metal, that piece of sheet metal, is still within the soft tissue of the forehead. So then that's even more support to show that that's there. Any questions on that one? I know this one can be a little confusing. Any questions that you guys can think of for this one? Okay. Number 7, a 4-year-old is brought into the emergency department crying. He cannot bend his left arm after his older sister pulled it. And the provider performs an x-ray and shows that the patient has nursemaid's elbow. The ED provider reduces the elbow successfully, and the patient can move his arm again after the reduction. We have S53.095, one with an A, one with an S, and then S53.032, one with an A, one with an S. So if we have an A and an S, we can assume that one is an initial encounter and one is a subsequent encounter, right? From our scenario, would we say that this is an initial encounter or would we say it's a subsequent? Initial, yep. So we can automatically go and rule out B and C without even looking at codes yet, right? So if we're confident enough in our knowledge of A, D, and S, we can assume A is initial, S is subsequent. Now, if you have some that are A's and B's and D's, you probably don't want to rule out without looking. But if you have an A and an S, then it would be fair to say that A is initial, S is subsequent, and we can rule out the subsequents. Okay? So next thing that we want to do is go look and see if it's the S53.095 or 032. So let's go look at S53.095. So S53.095 is an other dislocation of your left radial head. And then S53.032 is your nursemaid's elbow. So yeah, we want the 0.032 for our nursemaids. Okay. Any questions on that one?
Tiffany?
Yeah.
I'm sorry. I actually have a question on 6.
No, you're fine. You're totally fine. What's up?
As a new coder,
Mm-hmm.
how, with that encounter, would you know to use the M and the Z codes and not just the S code?
So if you're coding it from scratch, is that what you're saying?
Yeah.
Coding it from scratch, you would want to code the foreign body that's there, okay? Because that's what's bringing them in, right? Because he's saying he knows that he has a piece of sheet metal, right? So our foreign body is going to be it, okay? We know how that foreign body got in there, right? Because it came from that laceration that happened months ago. So if we know that the foreign body is a result of a laceration, then we would want to make sure that we code the laceration and the sequela phase of that. Does that make sense?
Mm-hmm.
And then let me go back and look at M79.5 because I'm pretty sure. Hang on, there's one of them that I think it's been a minute since I've fully looked at this from a coding from scratch standpoint. I think there is one of them that tells you that you have to code S01.82. A retained foreign body. Oh, no, you know what it is? Because the M79.5 is just telling you that there is a foreign body present. The S01 is telling us that it's the laceration, but we have to say that we know what the foreign body is that's present. And that's going to be the sheet metal, which is going to be the Z code that's going to tell us that there's a piece of metal that is retained.
Okay, so if we do it from scratch,
Mm-hmm.
and foreign body is going to give us the M, laceration is going to give us S, and then because it's a sheet metal, will give us the Z.
Yep. So if they would have just said that a foreign body was present, but they didn't tell us that it was a piece of sheet metal, then it would just be the M79.5 and the S01.
Okay.
But because they give us the detail of the sheet metal, we have to show that additional code to tell, give more detail.
Right. Tell the full story.
Yep. Mm-hmm.
Okay.
Yep.
Perfect. Thank you so much.
You're very welcome. Absolutely.
I have a quick question while you're kind of touching base on that. Is that okay?
Yeah. Yeah, absolutely.
Okay. So I get what you just said, but how do you know which order to put them in?
That's actually what I was just about to ask. Because I have the guideline here.
Uh-huh.
Sorry. Could I read
No,
it?
you're fine. Yeah, absolutely. If you've got your guideline pulled up, what's your guideline say?
Yeah, it says for traumatic injury codes S through T14.9, um, they're not to be used for normal healing surgical wounds or to identify complications of surgical wounds. The code for the most serious injury, as determined by the provider and the focus of treatment, is sequenced first.
Yep. So the reason that we're going to put the M79.5 first is because the foreign body is what brought him in, right? His knowledge of the foreign body is what brought him in. The foreign body was there because of the previous laceration. And then the detail about the foreign body, the Z code, is going to be last because that's just additional detail. It's not really affecting the treatment itself. Does that make sense? Okay. So
Tiffany.
Tansy, yeah, go ahead, Bailey.
So when would you use the acronym CAPE? Since this one doesn't have as many codes, would it still be the same?
Yeah, it would. Yeah, this one would still be because the M79 is the cause, right? Um, it's been so long since I've used CAPE. Remind me what it's cause.
Activity,
Hmm.
then place of activity, and external cause status.
So those are going to be when we have external cause codes. So if he would have said that the laceration happened while he was at work, then that's when you would apply your CAPE. But because we don't really have, besides the laceration itself, we don't really have detail as far as if it was an accident, if it was work, if he was operating a piece of machinery, whatever it might be. Does that make sense?
Yeah.
Okay, perfect. Okay. Any other questions? You guys are
I'm
making me
so
use my
sorry.
brain tonight.
I'm so sorry.
Oh,
Hey,
you're
this is going to
fine.
be quick because it says here code the most serious injury first.
Mm-hmm.
And here the metal is being coded first, I think. I'm just
Well,
confused about
because
that.
you don't have multiple injuries. So, really, whenever
Oh,
you
okay.
have not acute, when you have active treatments, initial treatments, and things like that, and you have multiple of those, that's when you're going to sequence your most severe first. But in
Oh,
this
okay.
case, since we're not treating the laceration, we're not treating the injury. That's why the M79 for the foreign body is being coded first, because that was the reason for the visit, not the laceration. The foreign body is the reason for the visit.
Okay, gotcha.
Okay, good. Good question. Y'all are making me use my brain tonight, man. Okay. Any other questions that you guys can think of? Okay. All right. Number 8's always a fun one. Fun, fun, fun burn. Okay. When you see a question like this, do not become overwhelmed with anxiety because you see all of the answer choices and you think, how am I going to answer this question in a matter of 2.4 minutes? Right. So I'm going to teach you guys some tricks. Okay. So we have multiple burns. The first burn that we have here is the 18-degree or 18% second degree burn on her legs. We have a 20% third degree burn on chest and arms. Okay. Total body surface area is 38%. So, knowing what we know about burns, if we have multiple burns of different degrees, which one should be sequenced first? Third degree or second degree?
Third degree.
Yep. So our third degree burn should be listed first because that is the highest severity, right? Now, here's my trick I'm going to teach you. Your fourth digit in your burn codes is going to correlate with the degree of your burn. So T21.21XA is going to be a second degree burn. T21.31 going to be a third degree burn. So if we know our third degree burn has to be sequenced first without opening our code book, we can automatically rule out 2 options because we know that the 0.2 is going to indicate second degree burns. Does that make sense? Okay. So now, knowing what we know, our second code is a 0.2, but we have 2 burns that have third degree, right? One on the arms, one on the chest. So our second code in this one starts with a 2. Our second code in this one not starts with a 2, but it has a 2 in the fourth place, as a 3 in the third place. Guess what? We have our answer. Didn't even open the book. Did I just hear a sigh of relief collectively amongst all of you? So, if for some reason you
So
have options, no, go ahead.
that was just thing. So the total body surface area, being that it's third, it was like 30, what, 38? That's
38% for your
being that it's
TBSA.
38%. That's considered a third degree, correct? You're saying?
No.
No.
We didn't even touch the TBSA for this question from
All
this
right.
trick. The only ones that I was doing was the third degree because we know we have 2 third degree burns here, right? Chest is 1, so let me change kind of our.
I see what you're saying, of the chest.
So the chest is 1,
Okay.
and the arms is 2.
Okay.
Yeah.
All right.
So we have to have 2 third degree burns anatomic location coded.
Gotcha. Okay.
Yep.
Okay. Got it. Okay. Thank you.
You're welcome. You're very welcome. Now, when you're talking TBSAs, what you have to do is, even if they don't give you total body surface area that's burned, so let's say they took this part out, you still know your total body surface area that's burned, right? Because you have 20% plus 18%. So that gives you your 38%. So even if they don't give that number to you, you still have to take that number into consideration whenever you're coding from scratch. Does that make sense? Okay.
I have a question.
Yeah, of course.
So the first code is for the chest.
Yes.
Okay, and the second one is for the arms on the third degree.
Yeah. So if you were to look up these codes, you're going to see that one is for the left, one is for the right. Because arms, we can assume that it's both, right?
Okay.
Because we don't have 4 arms, hopefully not. If we if they say arms, we can assume left and right. So then we would have to code individually for the left and for the right.
And that's why there's 3 codes for 30.
And then the same thing here, the 291 for the second degree, because it's legs plural, we have to do one for the right, one for the left.
Okay, I got it.
Yep. Okay.
Hey, Tiffany.
Yes, ma'am.
I have a question regarding the T31.32. If you look up the code, it says there's 2 percentages. Just for example, burns involving 30 to 39% of body surface with 20 to 29% third degree burns. So now when we look at that, the black is the 38 and the green is the 20% that says third-degree burns on her chest and arms. Is that how we're supposed to read it? Just to
Yes,
make
because
sure.
our total body surface area is 38%. So that's the 30 to 39%.
Okay.
And then we have to specify how much of that 30 to 39% is third degree. So that's going to
Okay,
be
got
where
it.
our 20% comes in. Yes, good
Oh,
question.
okay. All right. Thank you.
You're welcome. Absolutely. Any other questions about burns? So remember your trick. Your fourth character is going to correlate with the degree. So let's say you had a third degree and a first degree, right? Then you would want to look for the 0.3s, and then you would want to look for 0.1s. But in this case, it's a 0.2, right? But that does go for third, second, and first degree. Okay. Any questions that you guys can think of on this? Does it help? Does it really help you guys like not freak out so much on questions like this? Because like I said, normally when you see this and you have all of these options in a testing perspective, your brain's going to go, how on earth am I going to find all of those codes and figure out where to even begin? But like in this scenario, we can rule out two without even opening our book first. This one, it just so happened that we can rule it out without opening our books at all. But just know that that fourth character is always going to match your degrees. So just kind of keep that trick in mind. Okay. Number 9. We have newborn twin girls were delivered in the hospital via C-section at 27 weeks, weighing 850 grams for twin A and 900 grams for twin B. Both were diagnosed with extreme immaturity. So what ICD-10 codes are we going to report for the twins? Okay, where do you guys want to start?
I do have a question. I know the weeks of gestation are usually sequence lasts.
Okay.
So that can help with process of elimination, right?
Weeks of gestation are going to be Z3A, not Z3-8. And weeks of gestation are only going to show up on the maternal record and not the newborns.
Oh, okay.
Okay. Good question, though. Good question.
So in this case, then the basically the 27 weeks would be still sequence last, right?
Well, no, because we're not going to put the 27 weeks at all in there.
Oh, okay. Sorry.
Yeah. No, you're fine. You're fine. They put that in there to see if you're getting it confused for the maternal and the newborn
Okay,
record.
well, I did get it confused.
Yep. I know. Do you realize how many times my brain does it? And I have to like stand back and go, okay, am I coding for mom or am I coding for baby?
Yeah,
and then I have to go down the mental checklist. So it's totally fine.
Okay.
Okay.
Okay, so when you're coding for mom, then you would do gestation, and when you're coding for baby, then you wouldn't count that?
Correct. So for
Okay.
the babies, we're going to code for the outcome of delivery.
Oh, okay.
Yeah. Yeah. So on mom's record, we're going to code the delivery itself. We're going to code the weeks of gestation. For the babies, we're going to do outcome of delivery, which is going to be your live born, stillborn, whatever it might be. So for your outcome of delivery, those are going to be your Z38 codes. So we have 3 options that have Z38, right? Now, if we know our guidelines for newborns and the outcome of delivery and things along those lines, then we know that the Z38 for the outcome of delivery has to be sequenced first. Okay. So basically, we have to say on the birth episode, here's how they were born and here is the outcome of it. So If we know that guideline, then we're going to know what our answer is, right? But let's say, for instance, we don't. So let's just go to the Z38.31 real quick. And then if we look at Z38.31, that's going to be a twin live born infant delivered by cesarean. And then if you have the AAPC version of the 2024 ICD-10-CM, you look all the way at the top of that page, at the top of that column, it says this category is for use as the principal code on the initial record of a newborn baby. And it is to be used for the initial birth record only. So that sentence, this code is for use as the principal code on the initial record of the newborn baby. That in that sentence is telling us that has to be our first listed code. It cannot be second and it cannot be third. So Z38.31, if it's the first record, then it should always be first. Yes. Outcome of delivery is always sequenced first on the newborn record. And then if it's subsequent visits, if it's the second, third, fourth visits for the newborn, we're not going to include Z38.31 because this only goes on the very first visit.
Okay, and that being said, and I don't know who it was, but somebody said that if it was mom and we are counting gestation of pregnancy, that would be listed first.
No, we are
As
not
well?
ever going to report the Z38 on the mom's record. Z38 should only go on the baby's record.
Oh, I'm sorry. It was the
No, you're fine.
So like the mom's record, somebody said like that those would be coded first if it was 27 weeks or whatever gestation. That
Oh,
gets
yeah, that
coded
was me.
first. Oh, okay. Did you say it gets coded first? Is that right?
Well, I said, so if we're coding for the weeks of gestation, which Tiffany corrected and said it's Z3A instead of 8. Sorry, I also got that confused because I was working on that earlier. And I was coding it, I was sequencing it last, the weeks of
Yes.
gestation.
Yes, your weeks of gestation, Z3A on the mom's record should not be first listed and it can be last.
Okay, that's exactly what I wanted to
Yes.
know. Thank you.
Yes, I know Z3A and Z38 sound very familiar, very similar.
I know. And it's
So I'm
late
trying to
here.
make sure
I'm
that
like,
I enunciated the A and the 8.
yeah,
Okay,
Yeah.
thank you very much.
the coffee
Absolutely.
wore off already for me,
I-
so I'm just like getting
Mine has
by.
been worn off, so you are fine. So yes, mom's record is Z3A. Newborn record is Z38. So Z38 should always be first listed. Z3A should never be first listed on mom. Okay. Does that make sense? Everybody good now? I know there was a lot of back and forth and a lot of conversation about that. So knowing that we know that Z38 has to be first listed on the initial record, we're going to go with letter B. Okay. Any other questions on that one? All right. We are at time. I was hoping we would get through all 10 of them tonight, but we're at time. We had some really good conversation. So don't feel bad about not getting through them all because there was a lot of really good conversation, good questions. Can anybody think of any specific questions that we want to kind of go over very quickly before we disband for the evening?
Mine is not really what we're doing. I think the ones like the multiple, like the burn, where it's like 4, 5, 6, 7 codes are like the most helpful to me because when it comes to like taking the exam, I freak out because it's so overwhelming.
It is.
And
It can
then
be.
you can't,
Absolutely.
yeah. and then you can't write anything down. So that's like when I'm going through process of elimination, I'm like, oh my gosh, like where were we, you know?
Right. Now, keep
But
in mind, even though you can't cross things out and all of that on the exam, you do have a notepad on the exam. So you can write, I'm trying to do it here real quick, but it's not letting me. You can do A, B, C, D on your virtual notepad. And if you've ruled out A and C, you can put in little X's.
That'll help me out a lot. I appreciate
So that way, yeah. So that's just a little tip because trust me, I like to cross things out. You can see.
Yes. Yeah.
So when I took my E&M exam back in May, I had to do this because I have to visually see which ones are not an option.
So that helped me out a lot. And the other thing I was going to ask you is there any way that we could do in the future any like EM or cases questions?
So yes, evaluation and management, that is going to be on a whole session by itself. Evaluation and management will be. Yep.
Okay.
Yep.
Awesome. Cool.
Okay.
All right,
When is
thank
that
you.
session, Tiffany?
Say that again, Disha.
When is that session?
The E&M session is going to be in December.
In December. Okay.
Yeah. As of right now, as long as we kind of stay on track and we don't split things up more than what I have kind of already assumed that they're going to be split up, then it's going to be December 18th. But like I said, that's very tentative as long as we stay on track and we go through one chapter, one section each week.
Oh, okay. Got it. It's like how we did in the past for each section, like the respiratory. That's how we, okay, got it.
Now,
Okay.
as of right now in the Google Drive, I don't know if everybody knows where that's at, but as of right now in the Google Drive, there is a tentative schedule in there that I have it laid out as far as everything. So let me actually share the link for the Google Drive here in the chat. So if you guys want to open this and save this Google Drive document, this has the tentative schedule as well as the link for all of the questions.
And also back to what I was saying earlier, I'm still on chapter 18. I started a few days ago in the study guide, but I just don't feel the motivation. It's like I said, with the last two chapters, evaluation management, I looked at the answer key to get my answers for the op reports. I think I struggle a lot. I struggle the most with op reports.
Yeah, I think that's what a lot of people struggle with the most is those cases and those operative reports for sure. But we can apply the same process of eliminations to those operative reports from a testing perspective for sure.
I mean, but I think like I said earlier, I think what's making me a little feel like I've got a timeline is the fact that if I wait till the beginning of the year, the blanks is going to be there and there's going to be no more multiple choice.
Yeah. Yeah. And like I said, that's just something that you're going to need to, weigh in your, what's going to be best for you.
I wish I had a crystal ball, then I could look to see, what the outcome of that. So then that way I could be like, okay, yeah, like.
I know. Trust me, I wish that too.
Because then it's just for me, it's like, I think the thing that's making me second guess is like the fact that I got a job in the field a lot sooner than I expected.
Yeah, no, absolutely. And I think that would make anybody kind of second, question yourself too. So, don't feel like you're the only one facing that.
Basically, I post the same codes in every day, in every procedure. And I think the concerns I have is then let's say I look a few years down the road and then I start to get bored in this job and I want something new. And do you think that could happen as a coder?
Oh yeah, absolutely. I've been in positions where I switch and go into a new position because like you said, you kind of get stagnant in that role and then you go and you move into another position and it reignites that fire.
Tiffany, I have a question.
Yeah.
Okay. So I have the two exam attempts, right? So when I started the AAPC, they said I could take it the first exam, and if it's for some reason I don't expect it, hopefully I pass the first try. However, the second try, they say I have it in a year for the second try. Is that correct?
Yeah. So your voucher is good for 1 year for your initial attempt. If, let's say, you take the exam tomorrow, I'm just throwing out a date. I know you're not taking it tomorrow, but let's just say you take it tomorrow on September 19th and you do not pass. You have 1 year from September 19th to schedule your second attempt. It used to be that you had 1 year to do both attempts, but they have changed that. So you have 1 year to take your first attempt. And then from there, if you do not pass on your first attempt, then your 1 year starts over from the day of the not pass.
All right, thank you.
I mean,
you're welcome.
Like I know you, like I said, I know you said like to think it all through, but I mean, I think something that I consider now is the stress of the possibilities of what the exam would be like and worrying about whether I'm going to pass both times the voucher allows me. And the fact that I've still got much to learn. And I think it's just, I've struggled with making studying my priority these last few weeks, ever since I got this job.
Yeah. And I mean, like I said, it's just kind of one of those things that, I mean, you've just got to weigh your options and see, if you want to take it, once by December, just to see how you're going to do. And then, like me and Carmen had just talked about, you have a 1 year from the not passing to take your second attempt. So if you have 2 vouchers and you have, until December, use at least one of those vouchers before it expires, and then your 1 year resets. So that'll give you a whole extra year to study.
Thank you again for all your help. I mean, I think all I need to do is I think maybe what I need to do is I need to pray about what the Lord. Sorry, I don't mean to your religion, but I think maybe I need to pray and ask the Lord for wisdom on what to do.
Yeah, absolutely.
I think mostly, sorry to interrupt, and I'll keep this quick. Sorry.
No,
I think
it's fine.
Mostly, I think it's really just the guidelines. I realized before that I was trying to code with, just the codes, the answers, and doing process of elimination. But honestly, just remembering the guidelines are there to help, and reading those really help a lot.
They do. Yeah. Yeah. And like you said, it's one of those things that you don't have to memorize them. Just know and understand that you do have your guidelines there that you can always go back to and refer to, for sure. All right, guys. Well, thanks for having a good conversation and a good session tonight. If you need anything in the meantime, don't hesitate to reach out. I'm always here for you guys. I know I've been a little bit slower to respond these last couple of weeks, and I do apologize for that. Life has gotten absolutely insane. And as the study groups get a little bit more popular, people are wanting to do one-on-one coaching sessions. So my downtime is not nearly as available as it used to be. But just know that I really am working to get questions answered and, get back to everybody. It just may take a little bit longer for me to get to them. But as always, if you have any questions, do not hesitate to reach out. Okay. You all have a good evening, and I will chat with you next week.